Do cold sores, have anything to do with a dentist? You see lots of that happening, and do you have any solutions for those things? Because they're painful and ugly.
Yes, they are. Prevention is the best thing. Cold sore virus, you don't take an antibiotic for. There are different medications to be used depending on the age of the child. But prevention is the most important thing. If the adult has a cold sore virus on their lesion on their lip or on their tongue or in their mouth someplace, then they should avoid kissing their child or their loved one anytime while they have that virus for that 2-week, sometimes up to 3-week period of time. The cold sore virus is very contagious, especially when it's an open lesion, open wound that's weeping. You want to say called weeping, and there's liquid coming out of it. That pus-like material is very, very contagious. So you should not be eating off the same utensil. Do not feed your child off that. You should not be kissing them. You should not be drinking out of the same cup. Or if a child has it, make sure they're not interchanging. Children are very affectionate usually with each other. So if one child has it, make sure they understand not to kiss the other child, not to drink out of the same thing, not to use the same toothbrush, because those cold sore virus is very contagious. And once they get it, if a child gets let's say one child, Susie, has it in the family, and then little Johnny starts breaking out with a fever for a couple of days, that's a good indication little Johnny either ate off the same thing, drank off the same thing, or they kissed each other. And sure enough, after about 3 days, that cold sore virus will show up. The very primary time, the first time you get the cold sore virus, you have a fever for about 2 to 3 days. And then it breaks out in the lips or tongue or in the mouth someplace. And it is not a nice thing to look at.
Well, they used to, at least, from where I come from, they call them fever blisters.
That's why.
They don't call
because
it.
Because that fever,
that
only comes preceded. The first time. I'm sorry?
A fever is always preceded. So it looks
the first time you have it. Just the first time. It's called fever blister because the first time you get it, it happens when you have a fever for 2 to 3 days. After the initial outbreak, the secondary time you get it, you'll have, for example, I've had a cold sore virus for probably 40 years, and I'm just very well aware of I don't kiss my other members of the family. I don't drink out of the same thing when I have it, but I take care of it. I put a medication on there, but the medication I use as an adult, you would not use the same thing for a child. And so basically, you don't have that fever from that point on.
Okay. All right. So basically, just lock yourself in the room.
Ask your dentist. You want to ask your dentist what you can do. There are different meds out there. I don't want to give a list right now, but there are different medications that can be used for that. But the main thing is prevent it from getting to other people.
Okay. Does the mom have to bring the child to the dentist for it to see it, or just go to the dentist and say my child has this?
It is wise to get it checked out because there are other things that look like fever blisters with the initial time a child gets it, hoof and mouth or hand and mouth things. There are other diseases that mask looking like a cold sore virus when they're not that at all. There are other things called canker sores, aphthous ulcers that are bacterial. Is a bacterial infection, not a viral infection. There, when you get a white sore on the inside of the cheek, say, or underneath the tongue, and they look like they're a fever blister, but they're not. And they're not contagious. You can't give it to one another. So, when you get something like that, you're not quite sure it is, you should have it checked out by your dentist and evaluated whether they need meds, they don't need meds. Is this something I need to be concerned about, or do I need to see another doctor about?
Okay. Well, learning something more again. Thank you very much, Dr. Leisle. Bye-bye.
You're very welcome.